When it comes to the benzodiazepines, there can be a lot of adverse reactions, and most of them are associated with central nervous system suppression. You can end up with an overdose, which is very, very common these days. Most people don't just overdose on opioids, they often are mixing them with other central nervous system suppressants. You can cause extreme sleepiness, confusion. Eventually you can go into a coma. Your reflexes will diminish. Your blood pressure is going to drop. It's very easy to get tolerant to these drugs. And people find that when they're trying to stop a dependence on Valium or Xanax, it's very, very difficult. When you're nursing, if you try to separate a patient from their Xanax or a similar drug, it's very, very hard. Things that will interact with anti-anxiety agents, you can increase the effects of the benzodiazepines by taking them with alcohol. If you have had anesthetic for surgery, MAO inhibitors, which we'll be talking about when we discuss depression. We talked a little bit about the MAO-B inhibitors in chapter 9, but we'll be talking about them again in this chapter. Anything that suppresses the central nervous system is going to interact badly with these benzodiazepines, even Benadryl. Now, you can antagonize your central nervous system suppressants by taking caffeinated products or herbal products that act like caffeine, or if you smoke. Nicotine is a stimulant, and smoking causes constriction of the major blood vessels, which is going to lead to increased heart rate and increased blood pressure. And so they're going to work against the benzodiazepines, which is kind of ironic because when you see somebody who has stress and anxiety, often another way they relieve stress and anxiety is to drink coffee and smoke. And so they feel like that relaxes them, and they don't believe you when you say that caffeine and nicotine counteract the Xanax or Valium and sort of work against it, but that's true. But then there's a lot to smoking besides just the physical reaction you get, and people find it calming and comforting to have all those actions that go along with smoking. So tell them to watch herbal products that mimic caffeine as well. Lots of nursing implications when it comes to the anti-anxiety agents. You want to do a thorough health history, find out how long the patient has been suffering from anxiety, what has led to the anxiety. Is it external situations like job loss, personal problems in the family? This COVID-19 situation is certainly increasing everybody's anxiety. Or have they always been like that? Some people just have a tendency to be a little bit more prone to anxiety than others. It's just part of their personality. And it's a matter of sort of learning to cope with it and recognizing that you have that tendency. You want to look at what other issues and problems the patient might have, whether they're health problems or psychosocial conditions that can exacerbate anxiety. When it comes to elderly patients, you want to monitor them very carefully. Remember, these drugs have a long half-life, and because they are in adipose tissue more readily, the effect can be prolonged. You can encourage people to take these drugs with meals to decrease the GI side effects. You want to watch anybody who has suicidal tendencies. It is very common for anxiety and depression to go together. So you might want to just come out and ask, have you have thoughts of hurting yourself? Do you have a plan? Remember that central nervous system depressants can impair the person's cognitive abilities. They're not going to be as alert as they ordinarily would be. Warn them about that. They shouldn't be driving or operating any other kind of machinery. And then withdrawals can be very uncomfortable because patients get very dependent on these. On page 189, there's patient and family teaching. Several bullet points for that. You want to encourage patients to keep their appointments and follow-ups. Warn them about the adverse reactions that they can experience. They need to store the drugs safely away from children and pets, and in areas where the medication isn't going to get too hot or too cold or too damp. And very, very important to warn them about drug and alcohol interactions. The drugs are very habit forming, and ideally they should be taken for the shortest possible time, and probably augmented with some sort of therapy and coping mechanisms rather than just putting patients on meds and just turning them loose. These are some benzodiazepines, like I pointed out, that are commonly used. They're going to cause dizziness, so they can be a falls risk. The patient's going to get very drowsy, so they might want to take these meds at night. They can become very physically and psychologically dependent. They don't want to stop these drugs suddenly because they can have withdrawal symptoms. So that if they have been on these benzodiazepines for a period of time, they should wean themselves off and warn them that the longer they're on them, the more difficult it is to withdraw after you've used them for a long time. And patients have had to go to rehab to try to get off Xanax and Valium and similar medications. On page 187, we see some non-benzodiazepines that are used for anxiety. The primary one is a drug called buspirone, or Buspar, and this it doesn't suppress the central nervous system, it just affects the neurotransmitters serotonin and dopamine. They still will get a little bit sleepy and drowsy and should take these at night. Their method of taking it should be consistent. If they take them with food, they should continue to. If they find it's better to take it on an empty stomach, they should just take it the same way all the time. Don't take with grapefruit or grapefruit juice, because like it does with so many other medications, it can affect metabolism by working in the patient's cytochrome P450 system. That can increase the effect of the drug and make it work more powerfully than it is supposed to. Next, we'll be talking about antipsychotics, and we'll be switching to our ATI book.